Tonight, we're getting our first look at the results of a pilot program aimed at helping communities hit hard by the opioid crisis. Kaya Edwards talked to medical experts about how the First Step program is faring after its first year.
It took a couple of years of conversation to figure out how to best expand access to addiction treatment medications.
What we see in the emergency department are some of the downstream consequences of untreated addiction.
Then in summer last year, mHealth Fairview's emergency department launched a pilot program, First Step. Dr. Ziwe Ntaba leads it.
The City of Minneapolis Health Department has been a great partner with us.
Now the hospital is sharing results of the almost $390,000 program, telling us more than 500 people have benefited from it.
We see a fair number of people who have been resuscitated from overdose, but we see a far greater number of people who are struggling with addiction, and they're either coming here because they want treatment specifically, or they're coming here because of a traumatic injury as a consequence of their addiction.
Doctors have been able to get around 75% of the patients started on therapeutic medication meant to stabilize the brain structures dependent on opioids.
The medication that we're talking about is called buprenorphine, or Suboxone is a common name, brand name.
Narcan is also used to help patients come to if they've overdosed.
Once they come over to the machine, they use what's called compassionate care.
RN Topher McMenemy is patient care supervisor.
They then put in a 10-digit code, and then the medication is dispensed like a vending machine would be. We're able to give patients that medication free of charge.
There's also a recovery clinic down the hall, and since the program started, more than 2/3 of the patients connected with a substance use navigator who assists with prescription access and referrals. The program will eventually expand to all mHealth Fairview hospitals, and they have enough medication for that to happen.
Being able to provide medication to patients at the point that they're ready to make that change for themselves is really impactful.
Kaya Edwards, KARE 11 News.